Hello everyone, my name is Carlo and my group mates are Miguel and Vanessa. In this presentation, we will talk about hepatitis B and how it affects individuals and communities. And we will also be talking about important roles of public health nurses in prevention and treatment. In this project, we will be applying nursing research and epidemiologic concept to explore the impact of hepatitis B. Hepatitis B is a vaccine-preventable liver infection caused by hepatitis B virus, or HBV. It's one of the most infectious virus. It spreads when blood, semen, and other bodily fluid from an infected person enters a body of someone who is uninfected. The challenging part is that many people don't experience any symptoms, which makes early detection harder. The good news is that vaccine is the best form of protection. The CDC recommended vaccination for nearly everyone and also advises that adults be screened at least once in their lifetime. What is hepatitis B? It is a DNA virus that attacks the liver. Some people may get symptoms like abdominal pain, nausea, fatigue, fever, joint pain, or jaundice, while others have no symptoms at all. The virus spreads most often through childbirth, sexual contact, or sharing needles, but it can also spread less commonly through things like razors, toothbrush, organ transplant, or dialysis. If the infection doesn't clear, it can become chronic, leading to a more serious complication like cirrhosis, liver failure, or even liver cancer. Antiviral drugs and regular checks on the liver are part of treatments, and in severe cases, a transplant will be needed. There are two types of hepatitis B: acute hepatitis B and chronic hepatitis B. The acute hepatitis B is a short-term illness that happens within 6 months of exposure. In 2023, almost half of the acute cases were in adults between ages of 40 and 59. Rates were highest in non-Hispanic Black population, especially in Appalachian region, and overall rates have stayed pretty stable. Chronic hepatitis B is more concerning because it can last a lifetime and cause long-term damage. Right now, about 640,000 adults in the US are living with chronic hepatitis B. The highest rates are found in non-Hispanic, Asian, and Pacific Islander population, with chronic cases nearly 10 times higher compared to white population.
Hello everyone, I'm Miguel and I'm going to explain what determinant of health is. Determinants of health are the main factors that determine how healthy an individual is. This could be based on modifiable factors like smoking, drug use, and exercise, or non-modifiable factors like age and ethnicity. For hepatitis B specifically, it has been determined that an individual's health outcome is highly dependent on these 6 centers of treatment. Whether or not the individual knows about hepatitis B and how much education they have on it, whether or not an individual gets screening for hepatitis B and getting a correlating diagnosis, whether or not an individual has been vaccinated against the hepatitis B virus, whether or not they will start treatment or continue if nothing is wrong, how much the individual is engaged with their care and how involved they are and how willing they are to be involved in their treatment. And then whether or not an individual engages in upstream prevention like practicing safe sex and avoiding IV drug use. Again, these are not the only things that contribute to the health outcome of an individual, but they have been determined to be the most important. The epidemiologic triangle of hepatitis B, as you can see, is highly dependent on the host. Host factors that have been identified as common among individuals with hepatitis B are their lifestyle, including drug and alcohol use, sexual habits, having other comorbidities, specifically issues with the liver and co-infections. Age has also been identified as a common factor. A large number of individuals with hepatitis B have been 40 years of age or older, and the length of time that an individual has infection is typically longer with these individuals. Men are more likely to contract hepatitis B. Individuals with pre-existing liver damage or cirrhosis or having improper diet or a generally unhealthy lifestyle. Race is another common host factor, with Africans and Asians having a higher prevalence of hepatitis B than other races. A major host factor is having not been treated for or vaccinated for hepatitis B as an infant. So, what can you do as a community health nurse? Increase the public's awareness and educate them on hepatitis B. This can be done with educational pamphlets, presentations like this one-on-one communication with patients as well. The public should know about the benefits of screening and vaccination, the positive effects of preventative behavior like safe sex practices, avoidance of IV drug use, and screening for illness during pregnancy, allowing for alternate planning for childbirth if needed, and other comorbidities like hepatitis C, cirrhosis of the liver, and even HIV. Case management is another approach to treating the community. Take a step back and evaluate the affected community. Look for commonalities amongst the patients who are suffering from hepatitis B and identify ways to prevent contraction. Community vaccination and screening are direct steps to treating community at risk. This would also be a good time to educate them while they are there. Specialized clinics allow you to produce an individual's treatment plan that is specific to them. This would also be a good time to educate them on resources available to them in the community. The in-person clinic allows you to find an individual's barrier to treatment and overcome them with education and coordinating supportive care. For agencies and organizations for hepatitis B, one is the Hepatitis B Foundation. They describe themselves as a nonprofit dedicated to finding a cure and improving the quality of life for people affected by hepatitis B. On their website, you will find links to educational videos and slideshows that explain what hepatitis is, educate you on how to prevent contraction of hepatitis B, what post-exposure options are available, and treatment options for those who contract it. There is also resource links that outline your rights as a patient, direct you to online support groups, and provide links to podcasts. Treatment links to medication assistance programs, clinical trial finder, and a physician directory. Program funding. So the Hepatitis B Foundation provides funding to the Baruch S. Blumber Institute, which in turn supports programs that focus on drug discovery, biomarker discovery, translational biotech, academic programs, advocacy efforts for people with hepatitis B, including healthcare workers, and partnerships with Society on Liver Disease in Africa and Hep B in Philadelphia. Another organization available is the World Hepatitis Alliance. It is an international network of over 400 organizations in over 120 countries that work towards the goal of eliminating hepatitis by 2030. No Hep Mums is a program to offer free testing in 5 African countries. There are community impact programs that offer free online learning courses to better enable advocacy. No Hep Medical Visionaries is a program to educate medical professionals with info to help them fight hepatitis. Preventing Future Infections Project advocates for equal treatment in more heavily impacted areas in Senegal. The World Hepatitis Alliance has co-developed a briefing with United for Global Mental Health, highlighting the importance of treating mental health and hepatitis together. World Hepatitis Alliance has also developed another briefing encouraging those who read it to advocate for those affected by hepatitis A. And they also have a plan to speak to the UN in September about the link between hepatitis and liver cancer.
Hi everyone, my name is Vanessa. I will be going over evidence-based practice, community impact, and just wrapping up our slideshow for you guys. So currently there is no cure available for hepatitis B, so prevention remains the best form of treatment. We can help by educating the community on ways to reduce their risk, such as practicing safe sex, avoiding IV drug use, and understanding the importance of screening and maintaining a healthy lifestyle. It's also essential to provide education on liver health and how to keep the body strong and encourage vaccination against hepatitis B as the most effective preventative measure. For patients who have already contracted the virus, the main goal for treatment is to prevent cirrhosis, liver cancer, and other complications related to hepatitis B. Treatment options may include the interferon alpha 2A. It's a synthetic protein injected subcutaneously to enhance the immune response, or nucleotide analogous. Sorry, I'm probably botching that, but which inhibit viral replication, especially in patients with cirrhosis. We should continue to promote healthy lifestyle habits, especially emphasizing the importance of regular follow-up appointments to monitor liver functions and screen for liver cancer. And again, educating and reinforcing safe sex practices moving forward with these patients. For our community impact slide, hepatitis B continues to have a major global impact every year. There are around 300 million people living with chronic infection, and the virus causes approximately 1 million deaths annually. The disease disproportionately affects underserved populations who are often undertreated and face limited access to healthcare. While anyone can contract hepatitis B, it's more common among displaced individuals, people experiencing homelessness, and those with drug use disorders. There's also commercial sex workers, incarcerated individuals, and those living again in like a low income lifestyle who don't have access to healthcare. So the groups that are already vulnerable to health disparities, there's beyond the physical effects, the social impact of hepatitis B is very significant, and about 60% of individuals report that others avoid them, and 43% experience self-isolation due to the stigma of hepatitis B. Nearly half, about 48%, say that their relationships with their family and friends are negatively affected, and about 1/3 chooses to not share their diagnosis with loved ones. Okay, so in conclusion, it's important to remember that anyone can contract hepatitis B. The virus, again, spreads through infected bodily fluids, direct sexual contact, or by sharing needles. Hepatitis B can be often asymptomatic, meaning, many people don't even realize that they're infected, and that's why community screening is so important, not only for hepatitis B, but for other preventable diseases as well. We should continue to encourage safe sex practices, discourage IV drug use, and emphasize that the survivability and long-term outcomes of hepatitis B depends heavily on access to healthcare, including vaccination, screening, and treatment. Maintaining general health and practicing preventable behaviors and increasing knowledge of the disease all play a vital role in protecting individuals and the communities that we are surrounded with and who we go and help serve. And most importantly, people can't protect themselves from something that they don't know about. So it's very important that we continue to educate. We can also make a difference by creating and distributing pamphlets in our communities, and hosting community presentations and organizing screening events to raise awareness about hepatitis B and promote early detection. We hope you enjoyed our slideshow and our presentation, and thank you.